Hi, good morning. My name is Ruben Shizdava. Today I'm gonna demonstrate drawing of insulin. This is my school ID. This is my uniform. This is all my equipment. First, I'm gonna check my physician order. I'm gonna check the 6 types of medication, right patient, right drug, right dose, right time, right water, and then right documentation. Now I'm gonna pull up my patient EHR, and then I'm gonna check the order, and then I'm gonna check the medication against the order. And then now I'm gonna sanitize my hand using sanitizer to sanitize my hand, and then now I'm gonna gather all my supply. And then now I'm gonna introduce myself to my patient. I'm gonna knock on the door, and then I'm gonna close the curtain behind me, give my patient privacy. Hi, good morning. My name is Lobenchis. I'm gonna be your nurse today. Please, can I have your first and last name and the date of birth? Can I check your husband? I have two identification for my patient. Do you have any allergy with medication or food, environmental allergy? Okay, now I'm going to wash my hand, and then I'm gonna apply a clean glove. I use hand sanitizer to wash my hand, and then I'm gonna apply a clean glove. Okay, Mr. Smith, now I'm gonna explain to you the procedure. Today, the doctor has ordered some regular insulin. It is an immediate acting insulin. The insulin, it is just a hormone that we use to regulate our blood glucose in diabetic patient. It is just help to help your body move the blood glucose into the cells so they can use it for energy. Okay, side effect of this medication: high side pain, weight gain, and rash. Our concerning side effect of this medication have headache, blood evasion, palpitation, and dizziness. Okay, Mr. Smith, if you're experiencing one of these, please let me know. Some patients complain about a little bit of burning or singing. Just be aware. Okay, Mr. Smith, do you have any questions? Okay, Mr. Smith. Now I'm gonna check your blood glucose. I get 110, so I will go ahead to give you that insulin. Okay, Mr. Smith. After that, I will bring you a breakfast tray with them the next 30 minutes. Okay, Mr. Smith. Now I'm going to pull up your order in the mall, and then I'm going to check out the medication against the order. Okay, Mr. Smith. Now I will have a fellow nurse to come to verify those calculations for me. Okay, Mr. Smith? And then today the doctor has ordered with 4 units of regular insulin and 8 units of NPH. That's gonna give me a total of 12 units. And then I will have the nurse to come to verify those numbers for me. Okay, Mr. Smith. Now I'm gonna start rolling the vial, and then between my hand that is gonna just suspend anything as well as its warm to room temperature before I administer. Okay, Mr. Smith. Okay, now before I'm gonna make sure the insulin is nice and clear, because the NPH is so bloody by nature. Now I'm gonna use alcohol prep to clean each ball, the top of each ball. Okay, Mr. Smith. Now this is my 1 ml syringe. I have my 1 ml syringe, and then I'm gonna uncap. I'm gonna uncap carefully. And then now I'm going to withdraw 8 units of air. I'm gonna put that in, and then I'm gonna inject that into the NPH 8 unit. And then I'm gonna make sure it's not touch the medication. And then I'm gonna at this time I'm not gonna withdraw anything. And then now I'm going to pull up 4 units of air in the regular insulin, and then after that I'm going to inject that into the regular insulin. I'm gonna pull up 4 units of air. And then now I'm gonna withdraw 4 units of regular insulin. Now I'm gonna type for any air bubble, and then I'm gonna make sure to verify if I have 4 units in the mouth, to verify the syringe also. And then I'm gonna verify everything. I'm gonna make sure I have 12 units in the total, and then I'm gonna verify the mouth against the other. And then now next I'm gonna pull up 8 units in the NPH. I'm gonna inject that, and then I'm gonna pull up 8 units. I'm gonna tap for any air bubble. I'm gonna make sure this is the total of 12 units. This is my 12 unit. And then I'm gonna make sure to be extra caution to do not over this. And then also if I do, I will start everything back over. I will do my drop calculation over, and then I'm gonna make sure I have 12 units, and then I'm gonna check the MAR again. And then if I withdraw this away from the patient, and then I'm gonna make sure to carefully recap the syringe, and then label the dose and the medication, and then after that I will administer to the patient. After I administer to the patient, and then I'm gonna put the syringe in the sharp container, and then now I'm gonna discard everything, clean everything, and then I'm gonna make sure my patient is on position or comfortable, and then I'm gonna remove my glove, turn it inside out. Put it in the trash. And now I'm gonna use hand sanitizer to wash my hand. I'm gonna make sure my patient is on position or comfortable, and then now I'm gonna record my procedure, and then I'm gonna give my patient privacy, close the curtain behind me, and leave. Thank you.